Thank you on behalf of Asbury University for taking the time to review the supervisory training for BSW and MSW Foundation year. Hopefully this will be useful to you while you supervise our students. What you'll learn during this training is the basic overview of the classes taught at Asbury and the emphasis on theory and practice. The Council on Social Work Education's 2008 Educational Policies and Accreditation Standards, also known as the EPAS. How the EPAS is implemented into our learning contract and field evaluation. Differences between the BSW and MSW Foundation year forms. And expectations as supervisor. Here's a list of some of the classes that we teach in the BSW program. Introduction to Social Work is a 100-level class designed to set the table for beginning social work knowledge. Human Behavior in the Social Environment 1 and 2 deal with developmental psych, ecological model, and other things. Practice 1 and Practice 2. Practice 1 emphasizes micro-level skills such as counseling and assessments. Practice 2 emphasizes macro-level, but both incorporate the meso-level. Policy class. Students engage the different levels of policy, its importance for society, and begin to think analytically about how policy is implemented. In Services class, that's a survey of resources available in the region. Contemporary Issues is an ethics course. Senior Seminar is a capstone class to help students prepare for professional social work after graduation. And then finally, Practicum 1 and Practicum 2 are the two required practicum classes that each BSW major must have in order to graduate. In Practicum 1 and Practicum 2, we meet for 2 hours once a week to discuss practicum experience. This is where students process through their experiences and are taught to think critically about topics such as professionalism, systems, burnout, motivation and change, agency policy, safety, boundaries, and many more things. The importance for the student is to incorporate their experiences from practicum into their discussion in the class. If you will look at the handout given to you of the competencies and practice behaviors, I would like to kind of explain how those work out in a very tangible way. An analogy for the EPAS is that these competencies and practice behaviors are very similar to treatment planning. The competencies are the overall things that we want for our students that are similar to goals for a client. And the practice behaviors are the tasks that a student can do in order to achieve those competencies. So they're very much like objectives. If the problem for the student is to become a competent generalist social worker, then they should be competent in all the important areas according to CSWE and the EPAS. Those are professional development, ethics, critical thinking, diversity, justice, research, human behavior in the social environment, policy, leadership and social change, and practice. These areas of competency are similar to goals for the student. The practice behaviors are like objectives because they are specific and they are more measurable. For instance, practice behavior number 6 says use supervision and consultation. Practice behavior number 24 says critique and apply knowledge to understand person and environment. Here we are looking at the competencies and practice behaviors. I will read through these and make some minor notes as we go along. First, it's important to notice that when I refer to competency 1, you can disregard these first two numbers. Competency 1 says identify as professional social worker and conduct oneself accordingly. If you look below it, the practice behaviors, much like objectives, state, number 1, advocate for client access to service, personal reflection and self-correction for professional development, attend to professional roles and boundaries, demonstrate professional demeanor, demonstrate an understanding of the value of career-long learning, and use supervision and consultation. Each practice behavior connects to the competency number 1 of professionality. Competency 2 says apply social work ethical principles to guide professional practice. The practice behaviors connected to ethics are recognize and manage personal values to allow professional value to guide practice, make ethical decisions by applying NASW Code of Ethics and, as applicable, IFSW and IASSW ethical principles. Tolerate ambiguity in resolving ethical dilemmas, and apply strategies of ethical reasoning to arrive at principled decisions. Competency 3 states to apply critical thinking to inform and communicate professional judgments. The next 3 practice behaviors that are connected to critical thinking are distinguish, appraise, and integrate multiple sources of knowledge, including research-based knowledge and practice wisdom. Analyze models of assessment, prevention, intervention, and evaluation, and demonstrate effective oral and written communication in working with individuals, families, groups, organizations, communities, and colleagues. Competency 4 states to engage diversity and difference in practice. This diversity competency has the practice behaviors that attach to it that say, recognize the multicultural structures and values, and that values may oppress, marginalize, alienate, or create or enhance privilege and power. Gain sufficient self-awareness to eliminate the influence of personal biases and value in working with diverse groups. Recognize and communicate their understanding of the importance of difference in shaping life experiences, and view themselves as learners and engage those with whom they work as informants. Competency 5 states to advance human rights and social and economic justice. Practice behaviors connected to that are to understand the forms and mechanisms of oppression and discrimination, advocate for human rights and social and economic justice, engage in practices and advance social and economic justice. Competency 6 states to engage in research-informed practice and practice-informed research. Use practice experience to inform scientific inquiry, and use research evidence to inform practice. Competency 7 states apply knowledge of human behavior in the social environment. So they shall utilize conceptual frameworks to guide the processes of assessment, intervention, and evaluation. And finally, critique and apply knowledge to understand person and environment. Competency 8 says to engage in policy practice to advance well-being and deliver services. They will analyze, formulate, and advocate for policies that advance social well-being and collaborate with colleagues and clients for effective policy action. Competency 9 states to respond to contexts that shape practice. Discover, appraise, and attend to a changing context to provide relevant services. Provide leadership in promoting changes in service delivery and practice to improve service quality. Competency 10 states to engage, assess, intervene, and evaluate with individuals, families, groups, organizations, and communities. Substantively and effectively prepare for action at all levels of practice. Use empathy and other interpersonal skills. Develop a mutually agreed on focus and desired outcomes. Collect, organize, and interpret client data. Assess client strengths and limitations. Develop mutually agreed on intervention goals and objectives. Select appropriate intervention strategies. Initiate actions to achieve organizational goals. Implement prevention intervention that enhances client capacities. Help clients resolve problems. Negotiate, mediate, and advocate for clients. Facilitate transitions and endings. Critically analyze, monitor, and evaluate interventions. The 11th competency is one that Asbury University created in order to reflect our faith-based university. The 11th competency is engage clients with sensitivity and an awareness of their belief and faith perspectives and/or efforts to find meaning in life. The practice behavior we created connected to that states, demonstrate sensitivity and effectively assess a client's belief and faith perspective and/or efforts to find meaning and purpose in life. This is the BSW learning contract. The learning contract is supposed to be completed by the student and the supervisor within the first month of their placement. The main function of the learning contract is to help the student, the supervisor, and the professor understand the responsibilities that the student has at their practicum placement. It is strongly encouraged that the supervisor and student review the learning contract often during supervision time. This will ensure that the student is accomplishing all of the learning tasks that they need to do in order to get the appropriate grade. Identified tasks that the student will do from the learning contract are the things that the student will be evaluated on at the end of the semester. This first page is contact information and also a section that lists the top 5 major responsibilities that the student will have at the practicum site. The specific guidelines will help guide you if you have any further questions. As stated before, the student is responsible to turn this into their practicum class for a graded assignment. Make note, though, that the student should make copies of this learning contract, 1 copy for the student, 1 copy for the supervisor, and 1 copy for the professor. This will ensure that everyone knows what the contract states and what they are held accountable to, also to be reviewed during supervision time. This next section is to be completed by the agency field instructor. This emphasizes plans for orientation of the student to the field placement site, as well as plans to meet weekly for at least 1 hour for individual conferences with the student. This is called the supervision time. This begins the content area of the learning contract. There are important aspects of this learning contract to point out first. As you see in the left side of the table, there are checklists. Certain things are already checked with X's. These are learning tasks that the student and supervisor should do in their placement. Oftentimes, these learning tasks can be conducted during supervision time and/or easily implemented into the practicum agency. Each field learning task is a specific and measurable thing that the student and supervisor can do for the student in his practicum site. Each learning task, as you see, connects to a competency, and even more specifically, each category of a learning task connects directly to a practice behavior. In filling out this learning contract, each student should have every practice behavior identified with a learning task. If a student and a supervisor decide to just do the minimum requirements of the already checked learning tasks, then they will fulfill the requirement for practicum. But each student and each supervisor has the freedom to add to the learning contract in addition to the previously X'd learning tasks. The student has the ability to add an extra learning task underneath each section if the student and the supervisor agree to it. But just to notice that these are in addition to and should not be considered to be replacing. Here is the second page of the learning contract. Here is the third part. And then here's the last section. You notice at the end it's important that the student sign it, that the supervisor at the agency signs it, and then the faculty field professor will also sign this. Make note too at the bottom that the student should make copies. The end of semester field evaluation form will be the evaluation form that will determine the student's grade and also how well they have done at meeting the competencies. On the second page of the evaluation form, you see demographic information. This is for the student to estimate the number of sessions that they interact with these certain types of clients or in these certain types of settings. On page 3 of the evaluation form, you see instructions for completing the field evaluation process. Once again, it's important to note that the student should make copies of this evaluation form. In evaluating the student, you will notice that we have a rating system for the practice behaviors. The rating system is on a Likert scale from 1 to 5. For a rating of 5, the student consistently meets expectation for competency. 4, frequently meets competency. 3, usually able to meet the competency. 2, sometimes meets this competency. And 1, no evidence of meeting competency. The evaluation tables are according to the competencies. As you see, this first evaluation table is on the first competency of professionality. Prior to evaluating, the student will go through the evaluation form and put an X next to the field learning tasks that the student and the supervisor agreed to in the learning contract. These learning tasks are the means by which the supervisor and the student will evaluate themselves. As you see in the second table, the competency being evaluated is ethical principles. And as you see in the third one, it goes to critical thinking, all the way through all 10 competencies. On the final page, you will notice a re-emphasis that the student should make copies of this evaluation. The supervisor will make comments as to the strengths that they see in the student and identify personal or professional growth areas in the student. There's a section here for the hours completed that the student will put in. It is important that this has proper signatures. In this table, the student and supervisor will put the average competency rating for each competency depending on the table. This will be averaged out, and that average will be the student's final grade, which you can see by the field evaluation grading scale by quality points at the bottom of this page. If for some reason a student disagrees with this evaluation form, the student may check one of these boxes and attach a written response to why they disagree. If they agree with the evaluation, then they just check that they agree with it. This evaluation will be done with the field professor in attendance. The differences in how the practicum is ran between the BSW and MSW foundation year are as follows. The BSW field evaluation accounts for 50% of the final practicum grade, while the MSW field evaluation accounts for 70% of the final practicum grade. BSWs are a semester long, while the MSW has year-long practicums. There are slight variations in the rating scale between the BSW and the MSW foundation year. As you can see in the two different tables, it shows the differences in the wording. In order to be an effective supervisor under Asbury University's Council on Social Work standards, you need to provide at least 1 hour of clinical supervision per week for your student, a full orientation to your agency, including policies and procedures and safety. And also keep in mind that the students will treat this experience professionally. It's also important to note the student's experience level. Supervision must be at least 1 hour of individual supervision a week. The student should be prepared for supervision. And supervision is great for explaining agency policies and procedures, discussion of the population you serve, importance of self-care, person and environment discussion, ethical dilemmas in social work, discussion of the classes in which the student is enrolled, case studies, role plays, DSM-5 review, and discuss how you balance work demands and keeping up with research. We want to know how we can help you. If you have any ideas, please feel free to share them. We want you to know that we're here to improve the practicum experience. Feel free to set up an appointment with us. Call us or email us. Lastly, thank you for your time and thank you for completing this training.